The service was established in 2001. It's a community-oriented mental health service for older people with mental health difficulties, mainly functional psychiatric illnesses, depression or psychosis, and also people with dementia that may have behavioural or psychological problems. We have a multidisciplinary team, and it was my job to get the service started on the Greenfield site and to get a whole range of different disciplines involved, from medical, nursing, occupational therapy, clinical psychology, social work. It's been really important to have a good evidence base for this service. So from the very beginning, we've had a very strong research ethos, and we've been involved in a number of interreg cross-border European studies, looking, for example, at brain health and diabetes to prevent depression and dementia. We're involved in a drug trial for Alzheimer's disease, and we've done lots of services-based research to try to enhance the quality of care that we provide, the right care in the right way at the right time, as close to the person's home as possible.
As an advanced nurse practitioner working within the community mental health team, I'm a senior nurse clinician, and I work with those clients experiencing psychosis, passive or active suicidal ideation, and working with clients and their families in their own homes who are living with dementia and experiencing severe and distressing behavioural and psychological difficulties associated with the disease. So my role has three distinct components. First, as a clinician, working with my colleagues here in the team, primary care, older person services, and our aim is to provide a bespoke person-centred care package for our clients. The second component is as a researcher, so I participate and promote nursing research both locally and nationally. And thirdly, as an educator, I provide training and education within our own team, within the community mental health services and the wider services, but also within the community hospitals and nursing homes.
So I started as a second consultant in the service in 2019, and I will be leading a new team that will be full of multidisciplinary professionals, including an occupational therapist, a social worker, psychologist, a trainee psychiatrist and administration. And it's a very exciting development, and it will improve the services for older people in the area and build on the strong ethos of excellent culture of care for older people in the service. We will inreach to people's homes, into nursing homes. We will continue to develop our day hospital, but the focus will really be on bringing care to people where they need it and wherever their home might be. And that isn't just a hospital for us, it's in the community and linking in with all the services that are already there, including voluntary services and community services. It's a very exciting development, and I'm looking forward to continuing with this and getting the team on board, and we're in the early stages of development.
So the occupational therapists here in Liscarney, we see people on either one-to-one basis or in groups. In Liscarney House we run a lot of different groups. They're all recovery based. We look at, there might be anxiety management, recovery through activity groups, there'll be leisure groups, maybe reminiscence, and our gardening group is always very popular. The garden was renovated in 2019. It was a co-produced activity with service users and staff, and an artist and a gardener. And that garden was a huge asset over the last year or so with COVID-19, that we were able to use that outdoor space. And when we're in all those groups, we look at people's function and their ability to manage different aspects of their daily lives, and then we work on that more in depth, one-to-one in their own homes and communities, accessing resources and supports in the communities.
The referral system works by, we accept referrals from GPs and medical consultants in Sligo General Hospital, whether through their inpatient or their outpatient work. When a referral comes to Psychiatry of Old Age, the first point of contact is the team coordinator, and that's the role I fulfil. When I get the referral, I'll assess to see the urgency of it initially, and then see who's best placed to see that person from within the team. After going through that and establishing that there isn't a prior history or an involvement with another branch of mental health, I'll then approach the most appropriate team member to complete the assessment and report back to the team meeting on the following Monday. If the urgency is more than that, I can facilitate a much quicker response, and we can deal with it there and then. That's a slightly different role to some of the teams, and it's working very well.